Welcome again to Medicineify. We are going to upload a video with ECG patterns very soon. It's something very similar to our previous heart murmur video. Before that, let's brush up our theory in 3 minutes. The aim of this video is to allow you to differentiate 5 types of ischemic heart diseases easily. Right, let's move. What's an ischemic heart disease? It's simply the blood supply to the heart is not adequate for its demand. Mainly, ischemic heart diseases can divide into two: stable angina and acute coronary syndrome (ACS). We can call stable angina chronic coronary syndrome also. This division is basically doesn't have to depend on 12 leads ECG. It relies on symptoms. Stable angina doesn't really show symptoms at rest. Only shows symptoms with increased heart rate and contractility. It's because the stability of the plaque inside the blood vessel. Please refer the pathophysiology of these two. So we can use exercise ECG to confirm stable angina. Here is displayed how we are doing an exercise ECG. We allow patient to exercise in a treadmill, and with the exercise, cardiac contractility and heart rate increases. Since the ECG machine is already connected, we can see the difference with idle and with increased cardiac demand. So, talking about ACS, once occur, it's symptomatic even at rest. Acute central chest pain, a tightening like retrosternal chest pain, lasting more than 20 minutes. Pain radiating to jaws and shoulder tips or left arm. Please also keep in mind there can be ACS without chest pain in elderly and in diabetic. For signs, we can see distress, anxiety, pallor, sweating, and increased pulse. There may be signs of heart failure or a pansystolic murmur as well. Low-grade fever can also be present, and later pericardial friction rub or edema also can develop. Okay, enough talking about clinical features. Let's quickly move to our important part: how to differentiate the 4 types of ACS. We divide this into 4 by 12 leads ECG plus cardiac biomarkers. Clinical features are almost the same. The 4 types of ACS are STEMI, ST elevated myocardial infarction, non-STEMI, non-ST elevated myocardial infarction, and then unstable angina, and LBBB, left bundle branch block. Under STEMI, all these are progressive ECG changes. This arrow down shows the changes with time. So we can easily differentiate this from others with an 12 leads ECG. N-STEMI and unstable angina both can show ST depression and T inversion. Sometimes ST depression only, sometimes T inversion only, sometimes both. So, we need to rely on cardiac biomarkers to differentiate these two. The most specific and sensitive marker is troponin I. N-STEMI shows trop I positive, while unstable angina shows trop I negative. So we can differentiate these two. In LBBB, we can easily identify with W and M shaped QRS complexes in V1 and V6 respectively. We'll see all these real ECGs in our next video. Before the end, let's identify hyperacute, acute, early, intermediate, and late changes of ECG in STEMI. It will be very important to our next video as well. In hyperacute stage, the second picture, first 10 to 20 minutes, T wave is tall and wide. The third picture, Acute stage, minutes to hours, ST elevation occur. Progressive ST elevation. Next, the fourth picture, left bottom, early. Hours to days. Progressive ST elevation disappears. Progressively ST elevation disappears, but Q wave appears. You can see here the Q wave appears. Intermediate, the next picture, fifth one, days to weeks. Q wave is positive, T inversion also positive. So it shows that MI is days to weeks. Next, late, months. Q wave persists but T wave back to normal. Okay, thank you very much for watching. Please do subscribe to see our next video on ECG.